The teen health clinics began in 1969 as the Joyce Goldfarb Adult Development Clinic, a one-day-a-week maternity clinic. It almost closed in 1972 when Dr. Goldfarb suddenly passed away. But thanks to the efforts of the late Dr. David Mumford, Dr. Peggy Smith, and other passionate clinicians and individuals, it not only survived, it thrived. Over the past 40 years, the clinics have helped thousands of teens. For some, the clinics have been a major part of their adult lives too, including clinic staff member Angie Robertson.
I feel that the clinic have made a tremendous difference in the community and in our teens' lives. We not only care for our teens, but we also give them a setting where they can come, vent, kind of just be themselves. I was actually a teen clinic patient in 1985. My daughter is now 26 years old, and teen clinic staff not only take care of your needs as far as your family planning and everything, but it also have a great support staff social-wise to make you want to better yourself, to move further in life. So I just think it's an awesome, awesome place.
The young women who participated in a one-day-a-week maternity program really seemed to learn a lot. Their perinatal outcomes were improved, and so it seemed that it was a program that really shouldn't end. And so based on that belief, I went out and started to raise money so that the maternity clinic could continue.
Dr. Smith saw great potential in the clinic. She revitalized it to focus not just on maternity care, but on preventative medicine, education, and social support. It was a winning formula. For these young women, when one area of their life healed, another area quickly followed. They were staying in school, finding employment, and behaving more responsibly.
Well, in the early days, it was very difficult to determine, number one, where the funding would come from for those clinics. And I think that Peggy was so energetic and optimistic about continuing that service. She and I both had common understanding about the need for them, because at the time we were experiencing a significant increase in the number of children that were having babies. And so to close it didn't make any sense. So we jointly decided that there should be some support from the hospital district or from Jefferson Davis, as well as communicating with Commissioner Lee to get his support in keeping that clinic open.
The presence of the Baylor Teen Clinic being on the vanguard end of that and being out in the forefront has made lives better for thousands of people.
Until 2003, the clinic served only women, leaving out half of Houston's teenagers. So the clinic reached out to the most at-risk population, young men. Now, through the Foundation's male-only clinics, young men receive health care tailored specifically to their lifestyle. This is significant because when a young man becomes healthier, the rest of his family does as well.
The experience and what the clinic has given me itself, I can say it's helped me mature. It's helped me learn to love my daughter. It's also helped me to learn to love my future wife, hopefully. So I'm really happy with what I got from the clinic, and I think it would help a lot of other people out if there was a way to reach out to all these people, you know.
My name is Bobby Now.
And I'm John Now, and we've had an affiliation that began about 20 years ago. Dr. Peggy Smith called me up and said she wanted to come over and explain a program to me. And she did, and Bobby and I went to an event about 20 years ago.
And that was our initial contact with the Baylor Teen Health Clinic, and it's hard not to become involved when you speak to someone like Dr. Smith, who is so committed to the welfare of our children in this community.
Determined to reach even more teens, the clinic opened in Lee High School in 2005 and in Chavez High School in 2007, bringing together two of the most important elements in a child's life, education and health care. The results have been astounding. The clinics provide direct health care and counseling whenever teens need it, which helps them succeed in school.
Before the teen clinic opened at Lee High School, our students were getting very inconsistent and infrequent care, and sometimes no care at all. They would often have to wait in long lines for public health clinics, and sometimes the lines and the processes were so arduous and so off-putting that they wouldn't seek health care at all, which means that there were undiagnosed illnesses and injuries. And if they did seek health care, they may miss a day or 2 days of school just to wait in line to be able to see a doctor. So they were losing educational time, they were not getting the access to the health care they needed, and it was not good in any way for them.
The Baylor Teen Health Clinic sees 26,000 young adults in the Houston area through their 7 clinics. 22% of those that are seen are males, young men. That's a staggering number, and it shows that it's something that's needed and hopefully will continue to provide the services that these young men need.
The clinics now empower 26,000 at-risk teens a year, helping them to fulfill their potential and become healthy adults who contribute to society. With new technology and an interactive website, the clinics are reaching more and more teenagers every day. Because of all our supporters who devote time, effort, and money to the Foundation for Teen Health, the Baylor Teen Health Clinics continue to grow as a national example for health care.
Proudest moment is probably now, fast forward to this time, when I learned from my friend Angelina Jackson, nurse at the clinics now, that it's grown from 3 employees to over 60, and that instead of the 1 clinic once a week, now there are 7 clinics that work full-time.
In the last 40 years, it's made a big difference in the community and in my life. I've seen a tremendous amount of growth here in Teen Clinic, even for myself and all the staff. Everyone here is loving. I see us excelling even further than we are today.
They say miracles are people. People are their own miracle. So everyone that's ever given to the clinic, I really believe that they're a miracle, and I just want to say thank you.